I'm OHP's Member Communications Coordinator, and welcome to the Oregon Health Update Office Hours series for November. We have a pretty um, detail-filled agenda today, though slightly shorter than our previous ones. So we're going to be starting off today with some updates about OHP Bridge, as well as immigration and DACA expansion that's happening for that. Then moving into unwinding, where we'll be talking about normal renewals, as well as continuous eligibility periods, as well as what folks are needing to do during Medicare open enrollment and how that overlaps with people losing coverage now. Then there's a bunch of other updates happening to OHP as well in the next couple months that we just want to touch on, though those aren't going to be the focal topics of this meeting. We'll have more of that coming up next month. And then we'll finish out with some discussion time, questions about anything you want to raise today. But if you have questions, feel free to put those in the chat at any point, and we'll address those at the end of this section. Otherwise, I wanted to start today off with a little bit of a acknowledgement of some uncertainty that has been introduced to the healthcare system given last week's news. This is a message I wanted to share from our director, noting that any change in federal administration can bring some potential disruptions in healthcare policy. Our role here is to be monitoring, preparing, informing our members on how they can best get access to coverage, get access to the services they need under whatever policies exist at that time. We will be here to let them know how they are affected by these things and how to best mitigate those impacts as appropriate. OHA remains committed to expanding health equity, access to coverage. Those sorts of missions don't change with any change in federal policy. We have continued expansions of, like Healthier Oregon started in 2017, for instance. So the state direction is somewhat different than the federal direction. OHA's mission remains unchanged, trying to get people access to affordable healthcare, and that fundamental commitment remains. That is kind of the message that we want to see with any clients that are concerned about these sort of things as well. You as a partner, OHA as an agency, are going to be routes for help to understand their options and navigate the system as best we can. And we remain committed to trying to help get people covered however we can. So just wanted to provide that disclaimer. We'll have more guidance coming out over the next few months about program specifics, but wanted to share that as intro. Okay, with that out of the way, I'm going to hand off to Katie Waldo from our OHP Bridge team to talk about some OHP Bridge updates.
Thank you, Sean. Can everyone hear me?
I can.
Great. Okay. Hi, everyone. My name is Katie Waldo, as Sean mentioned. My pronouns are she, her, and I am the lead project manager for OHP Bridge in the Office of Health Policy. So we've just got a couple slides for you today, just to provide a general overview for those of you who might be learning about OHP Bridge for the first time. And then we'll be chatting through, as Sean mentioned, some updates regarding DACA, and then answering some community partner questions that have come to us recently. So just to start, a quick reminder, OHP Bridge is a new benefit in Oregon for adults with higher incomes. In order to get OHP Bridge, you need to have an income up to 200% of the federal poverty level, be between the ages of 19 and 64. So this is a program for adults only. Not have access to another form of affordable health insurance, and we'll be covering that a little bit more later in our partner questions, as well as have an eligible immigration and citizenship status to qualify. It is almost the same as OHP Plus as far as its benefits go. There's just a few small changes that we've covered in past conversations. It is a free coverage option, so there's no member costs or such as copays and deductibles. So that's just a really high level overview of the program. You can find out more at our website, which we'll cover in a few minutes. One really big thing that we do want to cover for all of you today as a reminder is that while we have one benefit package, the Bridge Benefit Package, or BRG, it is delivered by two sub-programs. So we have OHP Bridge Basic Health Program, and this is the sub-program that covers the majority of our Bridge members. It's managed exclusively through CCOs and does not have an open card option, and that's due to federal policy. We also have OHP Bridge Basic Medicaid. This is our option that we designed specifically for our American Indian and Alaska Native members, and it allows the enrollment. It's designed to preserve their right to choice between CCO and open card coverage. So that's going to be the smaller sub-program, but still a really important one. And again, they both deliver the same benefit package. So we have three key populations that we know will be moving into OHP Bridge since its launch in July and over the next about 3 years. And the first is individuals who have moved over from the Oregon Health Plan. So majority of these folks have already moved as we started the public health unwinding. So they were specifically moving over from our temporary Medicaid expansion, which we launched in order to provide a bit of a bridge between the end of the public health emergency and the launch of OHP Bridge. So majority of those members, again, have already moved over. We also will obviously have individuals moving into this program that were previously uninsured. So we've, again, already started to see that population move in beginning at launch on July 1st. And then the last group that we're kind of very aware of and watching for is our folks that are moving over from the marketplace. So one of the reasons we're highlighting this group today is that our open enrollment is officially live. And so we're expecting to start to see higher numbers of individuals moving over from their marketplace plans. So we're expecting this group to move over the slowest of the three. So starting obviously during this open enrollment, and then due to factors we'll talk about here in a second, kind of more, they'll trickle over the next 2 years. So as I mentioned, the marketplace group is the one that we're kind of focusing on today and most at present. So we wanted to chat through some resources that were available to all of you, and also just a couple of the key messages we want to make sure everybody's aware of. So the first thing is that we do have a brand new webpage that is live on healthcare.oregon.gov, and it speaks to some of the key facts and information that you might need to know for any clients that you're working with who are doing this transition. It's got some frequently asked questions and just some good info. So the link is there on the screen. We highly recommend that you take a look at that if you've got any clients in this situation. We also wanted to flag that folks that are on marketplace plans might be able to keep their plan for up to 2 more years, so through 2026. There's a couple things that need to happen for that to be true. The first is that they need to agree to do auto enrollment for the next plan year. And then they also need to be in a situation where they don't have to update their application. We do want to flag here, we are not encouraging people to not update their application if they have a change. If somebody is experiencing a life change, they are still required to go in and update their application. However, if they do not experience any life changes over the next 2 years that would need to be updated in the system, then it's possible that, assuming they have also enrolled in auto enrollment, that they will be able to keep that plan for 2 years. We also want to flag that if someone does find out that they are eligible for OHP Bridge and that they will need to be transitioning over, that the marketplace will not automatically terminate anybody's coverage for them. So the clients that find out they are eligible for OHP Bridge will need to go in and make the phone call in order to cancel their marketplace plan. That being said, we do also really want to flag that nobody should cancel their plan until they know when OHP Bridge will be starting for them. We don't want them to experience a coverage gap because they see that they're eligible and then automatically cancel their plan. So if you do have a client that comes to you that is, has learned that they are eligible for OHP Bridge, we encourage you to work with them to determine when their OHP Bridge coverage is going to start, so that they can call and cancel and in a way that ensures there will be no coverage gap for them. So just want to flag that. And lastly, from my section, I believe, we just wanted to make sure you're all aware of the partner trainings that are available to you. The first is just our standard OHP Bridge partner training, which is available in both English and Spanish, and I believe has been updated or will be updated soon with more up-to-date information.
Will be soon.
It takes, yeah, we're excited about that. We're trying to keep them as up to date as possible. That training does take about an hour to an hour and a half to complete. It's got a really good basic information for you to make sure that you've got a solid foundation on the program. We also have 2 live training sessions that will be available in December. The first is for community partners, which will be on December 4th at 10 a.m. And the registration links is on the screen. And then we also have another for insurance agents, which will be available on December 11th at 10 a.m. And that link is also on the screen to register. I know that was a lot of information. So if you have any questions, let me know. But otherwise, I think I'm handing it back to you, Sean.
Yep. And then we'll go into some of the big changes that are happening in November. Beyond open enrollment itself, open enrollment also brought a new change for both OHP Bridge and the marketplace, expanding the immigration categories that are considered eligible immigration statuses. So that definition expanded to add the DACA status, deferred action for childhood arrivals. Anyone who has that status where the government is not going to take action against them to deport them or anything like that. That status is available to people who arrived here as a child. There's some age restrictions and whatnot on that, but that program, anyone who has that, is the largest group of these. Then there are some smaller groups as well. People who have applied for asylum. So if they have a pending application for asylum, that now counts as an eligible immigration status for these programs, as well as people who have a pending application for adjustment of status, which means a green card application, essentially. It's for the legal permanent resident status once they have that application paperwork in. There's also another category called family unity beneficiaries, and then a few other categories of employment authorization that did not previously qualify. Most of those did previously qualify, most people who had employment authorizations. But these categories, for instance, DACA could get one, and so it's kind of a circular. All of these categories now qualify under the employment authorization as well. Just to clarify here, though, Healthier Oregon continues to offer coverage regardless of immigration status. This change is for the Marketplace and OHP Bridge, the two programs with higher income limits, which have a little bit more restrictive immigration status requirements that follow the Marketplace rules. So when that changed for the Marketplace, it also affects OHP Bridge. Other thing to note here, though, is that there's some uncertainty around this whole change. First off, we are waiting on a court decision specific to this change. That is currently being heard. We have not had a decision yet. That court did not block it before this change went into effect. So Oregon and the federal government made applications open to members on November 1st. You can now apply for this benefit, and there's a new application question in the one system and whatnot to do so. We will get a decision from that court case specifically, as well as a court case that is challenging DACA in general. We might also end up in a situation where DACA itself has changes coming from the administration itself. Under any of these circumstances, if courts block this rule or DACA is ended, members are not going to be penalized. We would tell them their end dates of any coverage if they're no longer eligible under the new rules. And general reminder that this does not affect your immigration status. Neither OHP Bridge nor the Marketplace are considered public charge. So we want people to access this benefit while they have availability to it, regardless of what happens. We have no indication, though, that it's going to be a negative decision there. So we want people to apply for this benefit. If they can get that application completed by the 15th of this month, they could have coverage starting December 1st. Updates will continue to come through this webinar series, as well as every partner email and other communication venue we have, if there are updates down the road. But just wanted to take a moment to acknowledge that uncertainty. Otherwise, we do think this is a fairly significant number of people. Per U.S. Customs and Immigration Service data, there's about 7,900 DACA recipients in Oregon, plus there's a few other groups with smaller numbers that we don't have exact totals for. I also put on the slide the stats for their age ranges. There are some specifics on how you enter children versus adults in this, in the one system now, but it's going to be very uncommon for them to be under 19 years old, which is the special circumstance there. But about 8,000 people are now going to qualify. We see them particularly concentrated in the Portland area and Salem area. There are also some additional resources available to support outreach to this population. We have a whole tutorial on the how to enter this in the one system. There's some new functions, a DACA checkbox in there that populates a little bit differently depending on if they're adult or child. We've got examples of all those three in a recorded video in English there, as well as a guide document that explains the change in more detail as well. You can also go to orham.info/resources and find a outreach toolkit, like social media posts, that sort of thing, as well as a member flyer that explains health coverage options for DACA recipients. So hopefully some good tools for guiding your outreach. We will also have a state memo coming out this week about that. It won't be a full press release. We're trying to do most of this through the partner level outreach as opposed to attracting media attention right now. Unless we have any questions about the DACA section, I think we're going to move back on to our partner questions. And Katie, take it away.
Yeah, absolutely. Okay, so this is a section that we do at every office hours. So we have, when we launched OHP Bridge, we knew that this could be a bit of a confusing and overwhelming experience to bring this new benefit package out into the public. And so we wanted to make sure that we had an avenue for all of our community partners to submit questions and inquiries to us and have a consistent place to receive answers to those questions. So we have 3 or 4 main ways that you can submit questions to us. The first is through your community partner outreach program Rocks, so your CPOP Rocks. They will then channel those questions back to us, and we will make sure to collect them and get the answers sent out. You can also submit a question via our Bridge email. So that's the email that's on the screen. And we again collect those and put them all together. And at the end of the month, we get a group of people, including policy and eligibility, communications folks together to make sure that we're getting you the most up-to-date answers. You also can submit a question when you register for this series. When you do that registration, it asks you to put in some information and then provides also a box for you to submit a question there. So you can drop them in there. You can also simply attend these office hours and ask the question in real time. So any of those 4 work. And then, as I said, what we do is we collect all the questions that come to us over the course of a month. And about a week before an office hours is held, we shut down the current questioning and we bring everybody together, get answers for the questions, and then prep them for today for the event. So we also do try to get the written responses back out to the original inquiry people that submitted the inquiry about a week or so following the office hours. I will say we do not always manage to do that. We are a very small team and there's a very small number of us managing the inbox. And so if there's a time where we're receiving a lot of information or a lot of questions through that, it can take a little bit longer. So the most consistent way to get your answers to your questions is to attend these office hours. So tell your friends to come is what we're saying. Okay, so without further ado, our first question that came in this month was regarding how the one system analyzes eligibility based on income and whether it was annual or monthly. So someone told us that they were recently informed that OHP Bridge only considers annual income for a household and that it does not look at monthly income, and they were looking for confirmation on that policy. So just to clarify, federal law determines our income threshold. So that's the first thing we want to make sure is really clear, is that oftentimes as the state, we have fairly limited flexibility in how we determine how income is analyzed by our programs. So based on these federal requirements, the one system considers eligibility in a hierarchy. So it starts by analyzing whether or not someone is eligible for OHP plus. So in that case, it's looking at the 138% of a monthly income or 100% of your annual income. If that person under that analysis does not qualify for OHP plus, then the one system checks to see if they have American Indian or Alaska Native status. If they do, then it will analyze their income for OHP Bridge Basic Medicaid. And currently, that means they will analyze their monthly income to see if it is below 205% of the federal poverty level. If the person applying is not an American Indian or Alaska Native individual, then they will not be considered for basic Medicaid and will instead be considered for OHP Bridge Basic Health Program. And this analyzes their annual income to see if it's below 200% of the federal poverty level. So we know this is a little bit confusing. We're hoping having it in writing as well will help too, because we know it's more confusing than we would prefer it to be, but we hope that this helps. Okay. So our next question was involving whether or not a person who has Medicare coverage as their primary with an OHP plan as their secondary can disenroll from Medicare in order to qualify for OHP Bridge. So we want to be extremely clear that nobody should ever cancel their Medicare in an attempt to qualify for OHP Bridge. There's a couple of reasons for that, but the chief among them or key among them would be that eligibility is partially dependent on whether or not a person has access to another form of affordable coverage. So it's not whether or not someone is actually enrolled in that coverage, but whether or not they're able to access that affordable coverage. So this means that if a person qualifies for Medicare, they generally speaking cannot receive OHP Bridge, regardless of whether or not they are actually enrolled in it. We also want to clarify that individuals above the age of that are 65 or older do not qualify for OHP Bridge. So we're made aware recently that I think there's some AI generated image information online when people Google this that is maybe leading to some confusion about this, but we do not want people to be canceling coverage in order to try and gain access to OHP Bridge. There's just a really high risk that it could lead to coverage gaps or them not being able to receive coverage in general. So. Okay, our last one came from one of our wonderful providers regarding what the billing address was for submitting claims, and then also what the payer ID is. So this is going to depend a little bit on whether the patient that they're submitting a claim for is receiving coverage through OHP Bridge Basic Health Program or OHP Bridge Basic Medicaid. So again, we have those two sub-programs that are administering the same BRG benefit. If a person is receiving coverage through OHP Bridge Basic Health Program, which again is covering a majority of our OHP Bridge members, this program cannot be administered fee for service. So as a provider, if you are unsure the address and ID, you'll need to contact the CCO that you are providing coverage through to get their information for their specific billing instructions. If the patient that you are treating is receiving their coverage through OHP Bridge Basic Medicaid, this program can, as we mentioned before, be administered both through fee-for-service and CCOs. So if the person is fee-for-service, you would want to contact provider services at the number on the screen. The payer ID for fee-for-service members is ORDHS. And you can find the mailing address on page 6 of the provider contacts list, which is also linked on the screen. And that address is going to depend a little bit on the type of claims. So that's why we're sending you there as opposed to giving you one. If the person is enrolled in a CCO, just like with basic Medicaid or basic health program, you're going to need to contact the CCO for their specific billing instructions. And I think that's all of our questions for this month. So I think I saw some pop into the chat though. So I want to take a minute to look at those. I also might have to call on Tim Sweeney if you're online in case these are policy based. Okay, so I see a question regarding if these adults have children, are they looking at standard OHP eligibility guidelines for families? Yvonne, I'm wondering if you could clarify, are you saying, do they consider FPL based on family size, or I just want to make sure I'm understanding the question.
Yes, I was just thinking whether or not they're looking at the 138% of FPL, right? Because they have children, that they are restricted to that type of coverage and eligibility, income requirements. And is this bridge really for adults without children? It's just strictly adults without children, no families, right?
Okay.
And that's 200%.
Okay, got it. So I'm going to try to answer and then let me know if I'm still missing your question. So it's absolutely not just for childless adults. It does not, so children cannot receive coverage through OHP Bridge. However, family size is taken into account when they calculate federal poverty level. So if you go onto OHP Bridge website, I think we have an income chart on there, and the FPL takes into account, changes based on the family size. So a family of 4, if you're an adult applying and you have a partner and 2 kids, your income your income limit will look different than an individual who's applying as a single or childless adult, if that makes sense.
It does make sense. And I did go and pull those up already. I was thinking of scenarios where you have couples that are living together in a sense, and maybe a child that's in their home is covered through OHP. Family dynamics can get pretty messy
Yeah.
Or not messy, but complex. I didn't want to use
Yeah.
the word messy. My apologies.
No, they look, families can look a lot of different ways. Yeah.
Right, and they're pretty complex, and I only use the word messy in terms of like trying to figure out where they all fit, you know, on the eligibility scales and stuff. But no, they can be pretty complex, and so I just wanted you know, just a clear answer on how that's determined. And just that confirmation you gave me that absolutely, of course, the children can't be covered through that, but they might be covered through another, they might be covered through the OHP.
Yeah. So you could have a
Yeah.
family where you could have a situation where one person in the family, again, based on whether or not there's like marriage and different things in there, different members of the family could be covered by different programs.
Yeah.
If that
All
makes
right,
sense.
great. Thank you so much.
Yeah. And Tim and Sean,
just
if
to add,
I missed something there, please add.
I would just add in OHA rules, in the same section of the rules where the called the edge formation, where we define in rule how the household is consolidated or counted or determined, whatever. It lays out how it is for OHP Bridge, and it is broadly very similar to Medicaid, but it is not identical in every respect. But it is similar, and it's laid out in our rules.
Thank you. Yes, and what got me thinking about this was like domestic partnership and how that is looked at by OHP and all of that. So it sounds like I can go to the website and get that information and what you were saying, Tim.
Yeah.
Yeah. Okay, great.
Broadly speaking, it's consistent with tax households for marketplace. So if the way somebody's income would be counted for marketplace for tax filing households, that will be how it is for Bridge Basic Health Program. Though again, there's lots of nuances, like you said. There's lots of different structures, but that's broadly how it's laid out.
Great, thank you so much.
Just to follow up on Tim's point, the rules for children's householding account for those complicated situations, like being split across different households and being claimed by different people. That's not going to apply to OHP Bridge as much. It's going to be much simpler there because we're just dealing with the adult rules. So in general, it's going to be pretty simple for OHP Bridge. Just follow the marketplace who's being claimed rules. For once in a while, when you see someone who's both tribal and pregnant and applying for basic Medicaid, they might see the pregnancy counted as a member of the household. That's the main way that rules between the two programs don't end up differing ever. Sorry to overcomplicate things if we need to, but householding rules also very slightly vary on the inside of things. So.
Yeah, thank you.
All right, thank you for that question. So our next question up here, I think, is from Lori. For marketplace enrollees who lose their plan and are moved to Bridge, will they lose their preferred providers? So the first thing I would say here is the provider networks from OHP to OHP Bridge are the same. We obviously cannot guarantee that a provider that is caring for someone through their marketplace plan will also be contracted through OHP and OHP Bridge. Ideally, we are hoping that there will be limited breaks in coverage continuity, but we cannot guarantee it. I think in our notices, and Sean, please correct me here, I think we do include information for how to refer providers to work with OHP if somebody is receiving coverage from one provider and finds they're not in network under OHP Bridge. There's some resources for trying to encourage providers to also contract with OHP, but we can't guarantee that the networks will be the same. Sean and Tim, please add to that.
It's not going to be in the notices itself. It's going to be in the next update to the FAQ language. Okay. Quick summary there. First off, if the provider takes any form of OHP at all, it's probably going to be easier to get them to negotiate what's called a single case agreement or contract with the other CCO, something like that. If the provider's full on refusing to take any form of OHP, there's likely not much we can do about that. It is up to the provider's willingness to take OHP or not and to contract with us. There's some pretty simple paperwork they can fill out if they're willing to. Otherwise, trying to figure out how to meet that service need through the CCO would be the main other way to go about that. So contact the CCO, ask for a care coordinator, explain the heightened need and what services you're not able to get met through that network. But the CCOs are required to have adequate networks to have those services available through their networks and help you figure out ways to get that service. So calling the CCO if there's troubleshooting needed on those would be the main route to help a client in that situation.
Okay. Moving down the list. So thank you for that question, Lori. Our next question is from Donna regarding whether that's 2024 or 2025 FPL. So currently it's 2024. I believe the FPL numbers are updated in March.
Yeah, they take effect in March of every year. We should get those in late January or so when HSS or Health and Human Services releases those for the year.
Okay. So you'll see the 2025 numbers go effective in March of 2025. Okay, Lori, we've got a question about how can I get more training about OHP Bridge? Do you have a training that brokers can take? So as we mentioned a couple slides before, there's one set of training that is just on-demand training that's available in both English and Spanish. And then we have 2 live training sessions that will be available in December. For insurance agents, we'll have one on December 11th at 10 a.m. And that link is on the screen. And then we'll also be going out after this meeting.
And we'll have our marketplace, my marketplace counterpart, Amy Coven, and I will be tag teaming that. So hopefully we'll be speaking to the insurance agent specific needs a little bit better there. But those trainings should offer some FAQ time in addition to the basic training. So that was really a request we got from partners that we wanted to support. So.
And Lori, I'm seeing it looks like the bridge training is not accessible to brokers. I'm not sure. I don't handle trainings very much, but Sean, do you know anything about
the
that?
intent was for both of them. If it's not accessible for any reason, you can reach out to your liaison. We can try to troubleshoot any issues. I don't know if it's Michael Mortimer or his team, but the intent is for that training to be for both of them. We are going to be offering it in December for both audiences. That's fully been the intent, is for both agents and assisters to be able to take that. And we've avoided the partner term too closely and specifically trying to leave the agent community in there too.
Okay. Let's see. Susan.
So I was just Christina from CPUP, but there are 2 questions in the Q&A function too. One of them was from Susan, and I see she posted it in the chat, but she says, do people need to apply for Bridge for January after November 15th? Will one be looking at the 2024, 2025 expected annual income at that point? So that was the first question in that Q&A.
So thank you, Christina. So OHP Bridge does not have an open enrollment period the way that the marketplace does. So it is just you apply at any point in the year where you think you might be eligible or you have a change in coverage, things like that. So with the 2024 versus 2025 income question, as we mentioned, the 2024 federal poverty level will stay effective and be the thing that we're looking at until March of 2025, when the new federal poverty level limits will go into effect. Does that answer your question, Susan?
So the first month.
No, because a lot of people are coming over from the marketplace right now and wanting to apply right now, but one only looks at this month and next month, and that would be only 2024 income, and they're not qualifying. And so I'm assuming they have to apply after the 15th for January, and then will it be looking at their expected income that they put in for for next year at that point?
It won't start looking until so the March month is the first one where it's going to implement that. So they're not going to start looking at the 2025 income until February. The next month check will keep that same this month, next month check will continue applying. So in that case, the person would remain on the marketplace if they're over income for OHP Bridge for the next few months. And then once the income limit changes, report a change to the marketplace. The marketplace should refer their application to OHP at that point if it thinks they'll qualify, or you could apply for OHP Bridge at that point through the one system. Did that clear it up?
No, because then people will be not insured because the marketplace is looking at 2025 in expected income.
Marketplace uses the previous year's FPLs. So
no, just what they're estimating, not the FPL level, what they're estimating. as 2025 income, will one start looking at that estimation?
One is going to look at their current, it's going to project their income for the next 12 months based off of their current month, what they report on the application at that time. So if that's the information they provide us at that time, and it's going to use that and determine it against the current year's income limits, the 2024, not the 2025 ones. If there's someone in that gap between the two income limits, they would have to report that change later in 2025. Or am I missing
Yeah.
something?
On the application in one, they ask your estimated 2024 income, and then
Mhm.
they ask for your estimated 2025 income already on the application.
And the system's going to continue applying the 2024 logic until the 2025 income limits take effect in March. Reporting a change after that should
Your
trigger the new
expected
action.
2025 income is just your expected 2025 income. I'm not talking about the FPL changing in March, just your expected income.
Then yes, it is already going to use that.
Okay.
Thank
It's
you.
going to use whatever you put into the
Can I-
application consistently. If that helps clear it up, it's just the income limits that'll change in March. Tim?
I was just gonna ask, are there instances where you're running into somebody putting their information in and healthcare.gov sending them to the state, to the one system, and then them not being determined eligible for bridge with the same information? Or is
I-
this more like addressing a
getting-
concern prospectively?
We're getting people referred from their insurance agent saying you should qualify for bridge now, and then them doing the application and getting denied right now because they're looking at this month's and next month's income, not looking at 2025 expected income yet, because one doesn't do eligibility that far in the future. And so my suggestion to them is to wait until after the 15th, when bridge they would be looking at eligibility for January. I'm just afraid that one won't look at 2025 expected income because people have lost their jobs. Their income isn't the same in 2024 as it will be in 2025. So that's what I'm concerned about. When will one start looking at expected income for 2025?
But so this is people who are getting sent by an agent, not necessarily by healthcare.gov. So they could still be eligible for the marketplace plan.
So based on what they're telling their agent, their expected income for 2025 is, they're saying you should go and apply. Like, there are people like losing their jobs changed and they're not making as much for 2025, but they still don't qualify for Oregon Health Plan or for Bridge this year, but next year they will.
And you're trying to get it, your suggestion to them is to delay past the point at which the one system will start displaying separate screens for 2024 and 2025 once we get
It
into.
already does. It
Okay.
has since October.
Are you seeing it not use the 2025 numbers, or is it seeming not to determine eligibility based on that? Is that what you're seeing then, or?
Correct. Because it's looking at this month and next month.
That feels like something we should take back and learn more about, to me, and examine whether or not that's working as intended. I will follow up with Christy, and then we'll get back to you. We'll provide an update in this next meeting, as well as probably talk at the CP work group.
Thank you. And then there was one other question from Lori also in the Q&A. So just wanted a clarification on the differences between OHP Plus and OHP Bridge, the benefit package, I'm assuming. But Lori, feel free to clarify if you weren't talking about the benefit package.
Well, there are two differences between the benefit package. You've got the HRSN benefits, the climate, housing, and nutrition benefits that OHP is rolling out. The housing benefits just launched November 1st. OHP Bridge does not have those benefits. It also does not have the option for long-term services and supports, which is the help with the tasks of daily living, like a personal home care worker or care in a nursing home. It doesn't offer those two add-on options. Otherwise, the benefit package is the same. Anything else? Otherwise, in the interest of time, I'm going to move us along.
Yeah, I see one question from Christy, but Christy, I think your question is the same one that Susan had. So I think we've answered that one with we're going to take it back and we'll revisit this at the next meeting. Let me know in the chat though if that's not the case.
Alrighty, we're going to speed through some really complex topics with the rest of our time. Moving on to unwinding, we are about 97.6% done right now. We have about 80% of people keeping benefit, or 81% of people keeping benefits. Then 2.1% of those are having a benefit reduction. That is most commonly someone going from full OHP to a Medicare savings program only. For those people, we really want them to consider their Medicare options. Additionally, we have seen the benefits ending category increase from about 16.1 to 16.9% over the last month. Again, with the population going through renewals right now, a lot of them have Medicare. We really want to get them to consider those options. So we've got a little mini training on choice counseling and whatnot coming up in the next few slides that will just try to get some information on basic question handling and whatnot so we can take a little load off of Sheba and Medicare agents who are doing all the choice counseling during Medicare open enrollment season. So the population going through renewals right now for unwinding is very heavily disabled or over 65 due to the Oregon Supplemental Income Program making up most of the renewals that are happening right now. A lot of those benefits were closed earlier during the pandemic, then we restored them in order to give them more time to respond and to update the notices, the system and whatnot to better hopefully catch more of them and keep more of them eligible if possible. We've got some additional efforts going on right now, trying to get our call center calling out to those people, their case managers if they have one, reaching out to them, as well as always, if you want a list of all the clients that your organization has helped that have not responded to the renewal process during the unwinding, those are available through your regional outreach coordinator if you request those. Otherwise, one of the main changes coming up right now is the return to normal renewal timelines. So through September 2024, all renewals had the extended timelines during the pandemic emergency. Starting in October, with the renewals going out in October, some of those timelines started to end, like the extended timelines for response specifically. By March 2024, we will be back to full normal timelines. So we're going to explain how those changes affect things. I do want to caution though that because of continuous eligibility, most renewals are still going to happen every 2 years. Some annual renewals will still occur, such as most OHP Bridge renewals, but the continuing focus for members is to respond before benefits end, or during the 90-day reconsideration after benefits close for non-response. That still continues after the pandemic. Just a second, I'm going to plug in my laptop. I forgot to do so. Okay. So we're heading into a interim period between October and December. First, the response periods are decreasing to at least 30 days rather than at least 90. Those renewals will have the extended adverse action period for a couple months, and then that is the next thing that ends. Then we'll have a few months of basically normal renewals, except for extended request for information timelines. So when a request for information or request for proof is generated after responding to a renewal, it would still get 90 days to respond to that up until February. Then after that, we're going to be back to full normal, where we have 30 days to respond and roughly 30 days advance notice of any closure. My computer's not charging for some reason. My apologies. There we go. Okay, so I've got a graph here on this chart showing the different timelines for the different waves. The light blue is the pandemic timelines. And then we have a couple months in gray where the closure notices are all going to stack up at the end of February as those timelines return to normal. There's the orange months where it's basically at full normal schedule again, though the request for information would be longer than normal, and then we will get to full normal in March 2025. Though we're still going to see the renewal caseloads be significantly lower due to the shift to 2-year renewal cycles. We also updated the continuous eligibility page. That's ohp.oregon.gov/CE. Did want to remind folks, though, that renewal dates may change and do no longer appear in the notices, and that is intentional. We want people focusing on the continuous eligibility period and the certainty offered there, not on the renewal date and when that's going to happen specifically. That may change. We want members to keep reporting changes, and then the state's going to tell them when it's time to renew. I wouldn't trust the date in one, for instance. After the next renewal cycle, the renewal dates and continuous eligibility periods will more predictably align, but during this current cycle, as we shift to from the 1 to 2 year cycle, there may be some renewal adjustments in 2025. So those dates are not certain if you see them in the system. More information to come on all of that coming in early 2025. Did want to provide a quick refresher on continuous eligibility, though. Most people can keep coverage for 2 years now. Young children keep it until they're 6 years old. That applies regardless of any income changes that happen between those during those periods. This also applies to basically all medical benefits with a few exceptions. This does include Medicare savings programs and Healthier Oregon. I've got a whole list of the exceptions on the next slide here. One key point that we've been trying to message that provoked this update, for instance, was there's a little exception in the rules where certain requests for information can still close your coverage, and that includes the request for Social Security number when a young child turns 1. If they're a newborn OHP member, they get to have that coverage for the first year without reporting the Social Security number. We need to get that at age 1, otherwise we can close for non-response. So just providing that within the first year of life will do. Otherwise, we will ask for it at their first birthday party or first birthday, and if they didn't respond to that, coverage could close. So there's only a couple programs that OHP that continuous eligibility does not apply to. That is OHP Bridge Basic Health Program, which has similar rules, I'll get into in a future slide, and 2 long-term care programs, specifically OSIPM with services and OSIPM acute care. That specific language would appear in notices, and the notices would lack continuous eligibility for those 2 cases, or those 2 specific types of OSIPM. Though most OSIPM members and most members with long-term care do get continuous eligibility, just 2 subtypes there. The other rarer exceptions are the Refugee Medical Program, which is for people in their first year here in the United States. That still has a 1-year limit. Most refugees will qualify for other OHP programs with continuous eligibility, though. And this does not apply to people who apply through the hospital presumptive eligibility application route, though if they put that application in through 1 and they qualify, that should get to continuous eligibility normally. So OHP Bridge information got added to the site as well. OHP Bridge Basic Health Program, the majority of members do not get continuous eligibility. They get similar protections during their coverage period. They've got a 1-year rather than 2-year coverage period. There are some additional reasons benefits can close for them, though. Most notably, if you get offered health insurance, your benefits would end at the end of that month following normal termination timelines, rather than for OHP Bridge Basic Medicaid, we would only end coverage if you actually enroll in the other employer coverage. So there's a little bit of a difference there. Basic Medicaid members are going to get the normal continuous eligibility protections, 2-year rules. OHP Bridge Basic Health Program would only get 1 year there. Then there's also, regardless of program, whether or not you have if you have continuous eligibility, regardless of program, there's some reasons your benefits can end. That's if you move out of state, do not respond to certain requests, specifically identity, immigration, and Social Security number, which is where the issue for children turning 1 comes in. We need to get that Social Security number, otherwise benefits can close in that first 6 years. Benefits can still end if someone passes away. Voluntary request is still an option. And then if there's a determination that you only got OHP due to fraud or error, benefits can end for that reason as well. The other one that you're going to see most often as assisters is that continuous eligibility does not apply or even appear in notices until the requests for information after an application are complete. So beyond that, there are some specific reasons for programs. OHP Bridge Basic Health Program can end if you get access to coverage through a job. So even if your job just offers coverage, that's enough to end your basic health program. For basic Medicaid, that wouldn't end it during the middle of your continuous eligibility period. It would only end if you enrolled in that coverage that is offered by an employer. Also a special rule for Medicare savings programs. If you lose Medicare, we can't help pay for your Medicare. So speaking of Medicare, we're in the middle of Medicare open enrollment season as well. That runs from October 15th to December 7th. That is the time of year when you get to make Medicare plan decisions such as changing Medicare Advantage, your Medicare supplement plans, and Part D prescription drug plans. Other big relevant period to members right now is within 63 days of losing OHP is your window to consider Medigap enrollment or a Medicare Advantage plan enrollment. So if someone's losing OHP within 63 days, they've got something equivalent to a special enrollment period. They don't use that term, but in order to get signed up and consider their Medicare options. Medigaps in particular don't want to let you in after that period expires, and you might not have that opportunity again. Main action there is really referring for help via the OregonHealthcare.gov Get Help Locator tool. That's where you can find a Sheba Assister, which is kind of like the Assister equivalent for Medicare plan decisions. They can do choice counseling, same sort of non-biased help that we offer on Marketplace side, or a Medicare agent who can offer the plan advice level. Both of those are through that locator tool there, which is also how you find assisters. So if you have a member that's losing OHP right now, first step, as with all members, is to review the notice, make sure all the information we used to make that decision was correct, report any changes if anything was incorrect, and if you disagree with that decision, ask for a hearing. For these members in particular, if they're found over resource limits, it might be worth going back to the eligibility worker one more time. Members may have options for redistributing resources to remain eligible. If they're over those resource limits, we really advise them going to talk to an eligibility worker, especially before making any financial moves in order to try to qualify. Talk to the eligibility worker first about options there. After they've figured out the OHP decision and understand what benefits they're on going forward, then you want to go to Sheba and send your client over to Sheba for help making their Medicare Advantage plan decision or whatever it is they want to decide there. They've got that 63-day window to sign up, and we really want them to understand what is on their notice. If they're keeping any Medicare savings programs, that's going to affect their decisions for which Medicare options they might want to go with. I'm going to give a quick rundown of each of these, understanding we're at limited time, but this is really just intended to be basic primary information and the sort of questions that Sheba will help answer. Medicare Advantage plans, also known as Part C, are a type of Medicare where you let a private company take over your whole Medicare benefit and administer it for you. So that bundles the Part A hospital coverage, your Part B medical coverage, and your Part D prescription drug coverage together. The main difference between these and regular Medicare is that they can offer some additional services such as dental, vision, hearing. Those are often the incentives to get people to enroll. They often have a premium that you pay for that, that may be $0. The cost sharing structure can differ significantly, and the network will differ. For Medicare members, you can go to nearly any doctor that accepts Medicare. For Medicare Advantage, you have to go to their specific provider network that they take. Those provider networks in particular have been changing. You may see some news stories about Medicare Advantage plans going out of certain areas and whatnot. Figuring out your other decisions after that happens is going to be one of the main things that Sheba can help folks with during this open enrollment period. The alternative to a Medicare Advantage plan is a Medigap plan, also known as a supplement. You generally can't sign up for these during the open enrollment period, but you can if you're in that 63-day window after losing OHP. Those plans pay the cost sharing after Medicare pays, so all of your deductibles, co-pays, out-of-pocket costs like that. But they follow the Medicare coverage rules. So it's going to cover the same normal rules and have the same provider networks as regular Medicare. Those plan costs vary pretty widely. Really depends on a whole bunch of factors like age and whatnot on what that would cost you, but it's that or a Medicare Advantage plan are the two core plan decisions people make there. Beyond that, there's also prescription drug plans that you can choose that may be bundled in with your Medicare Advantage plan. There's also a program called Extra Help that provides these plans to people for free. Being enrolled in any Medicare savings program will get you that enrollment automatically, but these Part D plans can be enrolled in separately, and you can get separate cost assistance as well with higher income limits than we offer for our Medicare savings programs. So those are kind of the Medicare plan options there. You decide between all those during Medicare open enrollment. One factor that will affect that is which Medicare savings program you have, if any. So on your notice, if it says you're keeping one of these, there are 2 levels of Medicare savings program. The QMB level, that is very similar to a Medigap plan or a Medicare supplement. If you have the QMB program, you probably do not need a Medigap plan. You could choose to enroll in a Medicare Advantage one, but it's less necessary. The other level of that is Part B premiums only, which does not provide any coverage. It just pays that Part B premium for you. So it's extra money in your pocket, which you can use to help buy one of those other plans, but it doesn't provide additional coverage. That level would not influence your decision. So making sure your client knows which of these 2 levels they're on before you send them away for Medicare plan advice is one of the main things we can do helpfully in this stage, as well as answer some of these basic questions and make that connection to Shiva. So pretty complicated topics there. I think I saw some chat coming in. Before I move on to other topics, can someone read out chat questions for me?
Hi, this is Christina. There wasn't additional questions. It was just people saying that they were dropping off.
Oh, okay. Then moving on. Bunch of upcoming changes. I just wanted to run down quick with the remaining few minutes. We've got the Medicare open enrollment period happening now. There's the Marketplace open enrollment period going through January. We just rolled out the OHP Bridge and Marketplace DACA change. November 1st also brought the housing health-related social needs launch. We had them here last month to talk about that. Next month, we will have 2 other waiver programs joining us, which will be the Young Adults with Special Healthcare Needs launch in January and the Nutrition HRSN benefit launch also in January. Very brief slide summarizing those changes. I won't get into that too quickly since we're over time. Young Adults with Special Healthcare Needs is an expansion for 19 and 20-year-olds starting January 1st who have specific conditions. There'll be some new screener questions added to the One System application that we'll get into more next month. You can connect with those programs here, though. If you would like to go get more information, there are some specific webinars coming up in the next month that you might want to check out if you're working with youth specifically or something like that. Otherwise, one other project that's coming up and agenda item for next time is going to be updates to the 7210 paper application. We are currently taking feedback in preparation for a round of updates to this that will be both updating the paper application itself, as well as making some small updates to the One System, though mostly wording changes, not functionality. We don't have major One System functionality changes in scope for this, but we want the 2 applications to match wording and whatnot. So we can make some changes to the One System side of things potentially, but focus is really on the paper application. We do want to hear your feedback on sticking points with the whole process, though. We'll be spending a larger chunk of the meeting next time as a feedback opportunity there, but wanted to flag that for you in advance. That way you have a month to think about potential changes you might want to see, pain points that your clients are experiencing with the application, and potential ways we might be able to make that easier for folks. Other than that, so we are to the end of the agenda and Q&A section. I think I might have seen another comment coming in the chat if we have anything.
People saying great information and having to hop off. So.
No, glad to hear it. Unless we're seeing any other questions, that is the end of the agenda for today. We'll hang out here for another minute or two if anyone has questions. Otherwise, I think that's it.
Thank you, Sean.
Well, not hearing anything. Thanks so much for joining us today, everybody.
Oh, there's
Appreciate your time.
question they're asking about which email to send questions to. Can we just drop that feedback? It's the feedback email, right?
Oh, is this for the paper application updates?
No, somebody just said, what email do you use for questions?
Feedback is a safe catch-all. I'm using my own email for that 7210 paper application updates. If it's about OHP Bridge, it would be ohpbridge@oha.oregon.gov. Feedback is safe for any of those, though. So I think that's probably your best bet. If you have more information about what sort of topic it's on, I'm happy to better direct it, though.
For feedback, okay. I'll put that in the chat right now.
Feedback's perfect then.
Okay. Perfect. And let me see if there's anything else. I don't think I see anything else. Okay, thank you, everyone.
Greatly appreciate it all. Take care.